Now more than ever, patients are experiencing more risk factors. Increasing BMIs, comorbid conditions, and recurrence are some of the factors driving the need for more thought about your choice for hernia mesh. It's not just a hernia. High-risk patients need more from you. Give them more. Gore offers the true hybrid biomaterial with a lightweight structure and permanent strength. Now in more sizes to facilitate wound healing and reduce risk for your hernia patients. Gore Synecor Preperitoneal biomaterial now provides extended sizes, including 5XL sizes from 30 by 30 to 40 by 50 centimeters to give you the choices you need to support permanent strength and wound healing for complex or high-risk abdominal wall defects. An extended range of sizes saves OR time and cost by giving you more choices to get the right fit. More risk factors require more flexibility to move beyond conventional composites to the true hybrid solution. Gore offers permanent strength that allows you to bridge a hernia or soft tissue defect. As the true hybrid, Gore Synecor biomaterial is uniquely designed with a combination of proven materials. A macroporous knit of inert, dense, monofilament PTFE fibers embedded between two bioabsorbable layers which deliver rapid tissue ingrowth and vascularization, providing a single-stage, durable repair in complex cases. In patients with complex comorbidities, the material you choose matters even more. These dynamics demand a low-profile, macroporous mesh material layer engineered to be stronger and reliably lasting with a minimal chronic foreign body response to increase patient quality of life and avoid time-consuming, costly complications. With the current risk environment, your patients need more from you. More size options, more strength and reliability. Give patients more with Gore Synecor biomaterial.